Hi, everybody. Welcome to Power for Parkinson's, Powerful People. Today, we're really excited to have Dr. Sule Tinaz from Yale University, a movement disorder specialist, who's here to talk to us about exercise and Parkinson's. And it's a great way for us to kick off Parkinson's Awareness Month and just get as much information as we possibly can. So, welcome, Sule, and take it. Uh, we're happy to have you here, and I am really excited for people to learn about the study, your most recent study that you've done on intense exercise and how it's impacted dopamine and neuromelanin, and so hopefully you can explain that to our audience.
Of course. Thank you so much for having me, Nina. It's a pleasure to be with all of you this afternoon. Yeah,
Sure.
and yes, well, when I first started working at Yale, I met Michelle Hespeler. She's the founder of this, back then it was local, now it's much more widely accessible, this program, Beat Parkinson's Today. And as someone with Parkinson's disease, who's also a physical ed teacher, a trainer, the program of Michelle's, the success of Michelle's program was really intriguing to me. And around that time, we also started seeing the evidence of the benefits of exercise in clinical trials. So we decided to join our forces together and do a study. It took us a while to get NIH funding. That's how it is with grants. So finally,
Yeah.
we got the award to do the study. And at that time, we were in the middle of the COVID pandemic. All gyms were closed. So the people with Parkinson's and the Beat Parkinson's Today program showed great resilience, and we were able to switch all the exercises to the virtual platform. So this was all done virtually. And if I may, I will share my screen just to show you all a few slides.
Yes.
Okay, so let's get started. I hope everybody can see my slides here. This is the published study, and it's open access. Anyone can type the title and should be able to read it freely. So we know that exercise is really beneficial for the symptoms of Parkinson's disease, and it's been shown to have the potential to delay the disease progression. And our main interest was the neuroprotective potential of exercise. Yes, great that it's good for symptom control, it delays the clinical disease progression, but does that actually mean it's also protecting the brain cells? And there is evidence from animal studies that this is indeed the case. And in mice and rats, it's been shown that this high intensity aerobic exercise actually does protect the brain cells. And some of the potential mechanisms are summarized here. Exercise suppresses inflammation in the brain. It promotes vascularization in the brain. So when you have more blood vessels, oxygen, blood, nutrients reach your brain more easily in abundance. And it also increases the secretion of nerve growth factors. So nerve growth factors are specific nutrients for brain cells. So if you take all three, these are just the main ones. There are many more other mechanisms. If you take all these three, you see neuroprotection, in our case, especially on the dopaminergic neurons. And that's exactly what's been shown in animal studies as well. So we were inspired by these preclinical findings. And we thought to ourselves, well, maybe we will actually see the same in human brains. So we enrolled our participants with mild and early Parkinson's in the Beat Parkinson's Today exercise program. They offer high intensity interval training classes. We can talk about that more. So 10 people completed the program. The age average was 65. They took 3 classes virtually online with a trainer, 3 classes per week for 6 months. And we did before and after evaluations, clinical evaluations and imaging evaluations. And how our definition of high intensity, there are several definitions. The one we used is being able to reach at least 80% of the age-appropriate maximum heart rate. It's a rather crude formula. So 220 minus your chronological age gives you your age-appropriate maximum heart rate. So if you're a 70-year-old person, your maximum heart rate would be 150, and 80% of that would be 120. For a 60-year-old person, the 80% threshold would be 128, etc. So you can do the math for yourself. And since this was all virtual, we had to purchase chest straps for our participants. And in the middle here, you see the heart rate sensor right in the middle of the chest. And while they were doing the exercises, we were remotely monitoring their heartbeat. And this is just a trace of an individual who was doing really well, going beyond his target. So the blue is the average, and red is the target. That's actually the 85% target. And he was actually doing the green dotted line. He was actually going well beyond that. And you can see these ups and downs, and that's because the exercise is interval training. You do something in a boost really rapidly, give a 10-second break, and then again. So that's why you see this seesaw pattern here. Yeah. Just as an example. So this is how we traced people to ensure they were actually really doing it at high intensity. And what we found was, we did two different, let me just tell you a few things about the imaging modalities we used. We used MRI scans, so magnetic resonance imaging, specifically measuring the neuromelanin content in the brain. We also used PET scans. I'm going to get to that in a moment. Just a few things about neuromelanin. Neuromelanin is a substance, is a complex molecule that contains dopamine. So it's just dopamine goes through various processes and it accumulates in dopamine producing cells in the form of neuromelanin. And we can actually detect the signal that comes from the substance using specific MRI sequences. On the left-hand side, you see within this red rectangle that looks like the Mickey Mouse. This is the midbrain here, and these bright white spots are the regions that's called Substantia Nigra, are the regions that contain dopaminergic neurons, and the neuromelanin inside them looks bright. So you can see it here. And this is the part that we focused on. And on the left-hand side, you see the average of 10 people, average baseline neuromelanin content. This is color-coded here. And on the right-hand side, you see the post-exercise scans. To your naked eye, it already looks brighter, right? Brighter and more yellow. The hot color, the better, the higher signal. And when you actually look at it quantitatively, there is an increase here. And the PET scan used the dopamine transporter protein. Dopamine transporter protein is, again, produced by the dopaminergic neurons. I'm not going to get into details. Some of the people in your audience may have had the clinical scans. They're called DAT scan, dopamine transporter DAT scans. Those are clinical SPECT scans, very similar to the PET scan that we used here. It's the same thing, measuring the dopamine transporter in the brain. Again, if you look at the same brain area, at the bottom, you see that region where the Substantia Nigra is located, enlarged. And baseline to post-exercise, you see the signal increase indicates a higher dopamine transporter signal. So the red hot colors mean higher signal after 6 months of exercise. And other parts of the brain, I'm not showing the pictures here, but the other parts of the brain that also receive these dopaminergic projections, the putamen, the caudate, other brain areas, they also showed increase in signal. But it was most significant in the Substantia Nigra, where the actual dopamine-producing neurons are located. Since this was a pilot study, we didn't have a control group. it wasn't a proper clinical trial. It was just a proof of concept pilot study. So we compared people to themselves, right? The baseline and post-exercise. So an important question here is, well, okay, you see the increase, but is it actually meaningful? Is it statistically significant? Mm-hmm. At this point, all we can say is, in a way, it is significant. So we know over the course of 6 months or a year, how much decline one would expect in the dopamine signal and neuromelanin signal. So there are larger cohort studies that shows us the natural decline in people who are comparable to our cohort. Compared to that expected decline, our findings were significant. But we should take this with some grain of salt, and we have to replicate the data using designing a proper clinical trial, randomized controlled clinical trial. But we thought this was exciting. We were able to detect the signal. We were pleasantly surprised. We were not expecting an increase. And our wildest dream was, well, maybe we're not going to see as much decrease, but seeing this increase was really rewarding and really reinforced my belief in the importance and the neuroprotective potential of exercise. And we can get to this later if you want. These are some infographics, recommendations for exercise. So I'll stop sharing here for a moment and answer any questions you may have.
Okay, well, I think that study is so exciting and fascinating because since we work with people with Parkinson's every single day, and we see how well they do. But when we saw your study, I mean, even though we've already incorporated high intensity exercise, it just we just became even more intentional about it than we had been, and it's remarkable, like the feedback we get from people, because they seem to feel so much, they really feel better after doing that and those bursts of exercise. So is that, and so your study was for people that were early on in their disease, and do you see like a correlation as how, for people further along?
That's a very important question, and that we need to do more research to answer that. We cherry-picked our population, right? So we wanted to make sure these people had mild disease so that they could do the exercises at the required intensity. And, early in the disease process, average disease duration was about 2 years, somewhere between 1 and 4 or so. And the average was 2 years, because our intention was to be able to detect the signal in the brain. So if there is a lot of loss already over the course of 15, 20 years or so, you may not be able to detect a small increase. So in the study, we, like I said, handpicked our cohort. This is not to say that if you've had the disease for a longer period of time, you're not going to have any benefit. There won't be any neuroprotection. These are unanswered questions. We need to do more research, obviously.
Right.
Yeah.
So could you see, I know you used a heart rate monitor for people, and I mean, of course, not everybody has that or a watch, but when you're talking about high intensity and with people with Parkinson's, I think one of the things people aren't always aware of is the cardiac side of Parkinson's, like some of the what can happen to the heart. Can you explain and maybe why that your heart rate response may not be what everybody else's is?
This is a very important question. Yes, it can be, the response can be blunted in Parkinson's, and there are physiological reasons for that. In Parkinson's disease, the nerve endings that go to the heart muscle, they have adrenaline, noradrenaline. And when you do some physical activity, physically exert yourself, so there is noradrenaline discharge to the heart muscle, and that prompts the heart to beat faster. So if you do high intensity exercise, there should be more noradrenaline stimulation to the heart muscle so that it can beat faster. But as part of the disease process, unfortunately, those nerve endings die off. So the heart muscle does not get the noradrenaline stimulation to beat faster. So that's one major reason why the heart rate doesn't go up as much as you would like in Parkinson's disease. There are other reasons, obviously, but there might be blockage in signaling in the heart muscle. Some people need rhythm control, heart rate control, medications that control the heart rate for cardiac reasons. So all those factors contribute. That's why I tell my own patients in the clinic when I recommend exercise, high intensity exercise, not to be too obsessed with the number. Instead, maybe putting a lot of effort into it, really working with a trainer and subjectively really panting and not being able to put more than 2 words together means you are really doing a good job. You know, the subjective effort rating, Borg effort rating has been validated in Parkinson's disease. So we can just go by that subjective rating to ensure high intensity.
Yeah, I love that and that whole concept of perceived exertion. So we try to convey that. And in our classes, like our in-person classes, we conduct them in a group. So it's always remarkable to me that everyone, no matter what degree of Parkinson's they have, people are keeping up and doing, they keep up with each other, whether it's just that group dynamic or just the way, the classes are conducted. But it's really amazing to see people, they push themselves and push each other.
Absolutely. And I think the group dynamic makes a big difference. That camaraderie, that social support, trying to do your best. I think the social element there, it really makes a difference. And it also improves adherence. People go more frequently, attend classes, in my experience. So that's a big bonus to do it as a group. And also it's worth emphasizing, it's not for everyone, right? If you have any contraindication, so you can't just jump into, oh, okay, I'm going to do high intensity exercise. That's not a safe approach. It really must be discussed with your neurologist, your cardiologist, if you have cardiac issues or severe orthopedic problems, etc. So safety first. It may not be safe for everyone. And there are specific eligibility criteria for high intensity.
Yeah. And we try to counteract that by just having a lot of seated classes, and let people do what they feel comfortable, to whatever degree they feel they can push themselves. So in your study, could you also just explain, like, what was the high intensity exercise that they were doing? Like, how did you?
It was the interval training, the high intensity interval training, doing really aerobic exercises in short bursts with brief breaks in between. Yeah, so whole body, high intensity interval training.
And they did it, I'm sorry, you might have said in the study, but how many times a week were they doing?
3 times a week, minimum of 3 times a week. Yes, that is also the guideline, the recommendation, at least 3 times a week. And what's nice about the program, it incorporates everything. And, you can do treadmill only, and that would count as aerobic exercise. But I don't think that's enough in my experience. And according to the guidelines, it should be a more comprehensive exercise program, right? Resistance, aerobic, balance, neuromotor training. And the program that we used incorporates all of that within that 1-hour class. And I'm sure your program does the same thing. So that works better. And that makes it a bit more interesting for people too. Treadmill is a bit monotonous.
Yes,
Can be.
Well, I agree with you. I think that's, just from my observation, is that, the walking and running or biking, it's hard for people on their own to push themselves. And then when they're integrated doing multitasking and complex exercises, it adds something that, unique and it helps push people more, I think.
Yeah. I don't want to discourage people.
Oh,
Bike,
no. They should
stationary
do whatever
bike,
they want.
treadmill, stationary bikes, it's wonderful
Yes,
exercises. But if we can add a little bit more to that, even better.
absolutely. Good point. Good point. So what have you seen in your experience working with people with Parkinson's? Like, how does it improve their daily life? And what kind of changes have you observed?
Great question. Yeah, the mobility, energy, definitely, the balance, posture.
Mhm.
So
Yeah.
pretty much every single motor symptom seems to improve, in my opinion. I've had patients who didn't need to start taking medication for 2, 3 years just because of exercise, or I didn't have to adjust their dose because they were doing so well with just exercise. Anecdotally, I can see in my clinics, those who exercise tend to do much better. But maybe more importantly, or equally importantly, how it empowers people, right? The self-confidence, their mood improves, their sleep improves, and more importantly, self-confidence, and having some agency, not feeling as a passive victim of this, neurodegenerative progressive condition, feeling that you have some control over the course of the disease, and
Yes.
how energized and empowered people feel because of exercise. I think that's extremely important. It's called self-efficacy, right? Having some agency,
Yes.
being able to control your disease and how it progresses makes a huge difference, I think, in quality of life.
So I love that the way you say that, and I think I've been doing this, working with Power for Parkinson's for 12 and a half years, and there's been more and more research over that period of time, and more neurologists, movement disorder specialists are on board with the whole concept of exercise, and that it is like a prescription for someone with Parkinson's. What is your experience with your colleagues and the movement disorder community?
That's a very important question. Yes. And I mean, here in Connecticut, I've been lucky. We have a lot of Parkinson's specific exercise programs, support groups, and events. For a small state, there's a lot going on for Parkinson's. And my other colleagues, neurologists and movement disorder specialists, are aware of the benefits. And they do mention exercise, the importance of exercise. This is probably not the case across the board. I hear some stories that this is never discussed during a clinic visit, maybe dismissed even. So we really have to do a much better job as healthcare professionals to educate ourselves, to really spend some time discussing during a clinic visit, sparing some time to discuss the importance of exercise, explaining, guiding people. Very, very important, because it's been shown in some international surveys when they interviewed people with Parkinson's about the potential barriers and enablers to exercise. There are several barriers, as you can imagine, either the social context or disabilities, lack of access, etc. And one of the most important enablers is the clinician telling the person, exercise important, you should do exercise. And also the social context, exercising with a group of people, having someone in the family to motivate them, and then having good trainers to help them. Yes, but as clinicians, we have to do a better job, I think.
I mean, I think I agree with you. I mean, I know more and more people are getting on board, which I think is fantastic, and they're seeing the results. And I think just what you're saying, finding something that people enjoy and that they stick with, but also trying to change things up a little bit. So they are also stimulating their brain and their body at the same time and getting their heart rate up and all the good benefits of exercise.
Yeah, and it should be accessible to everyone, right? It should be affordable. It should be accessible. It's a human right.
That is true. That is true. And I've talked to many of my colleagues, that do run exercise programs that are Parkinson's specific. And what we found is sometimes the exercise part at a conference or something, it's just kind of overlooked or just glossed over, like, oh, it's just another form of exercise, or it's not important, whereas it really should be a highlight, as important as medication at this point. So,
Exercise is medicine. That's how I
yeah.
phrase it when I talk to my patients in the clinic. This is your medicine.
Yeah, that's great. Let's see. We have a few questions that have come in.
Right.
Let's see here. Let me look. Okay, Robert, who is a friend of our channel for sure, and a PFP. Hi, Robert. He is asking if exercise also affects serotonin production, and is there a link between the brain reward system with serotonin and dopamine?
So, serotonin secretion as a result of exercise, I can't think of any studies off the top of my head. But dopamine definitely is the major neurotransmitter involved in reward circuitry. I think that's the reason once you start going, it's really rewarding and you keep on going. It definitely activates the reward circuitry in your brain. Then it's modulated by dopamine. Serotonin is the feel-good so-called neurotransmitter, right? It's good for your mood, good for symptoms of depression, not directly linked to reward, but it's relaxing and it's good for depression. And it's been shown that regular exercise is extremely beneficial for depressive symptoms in Parkinson's disease, probably through serotonin, but we have to demonstrate the link. I don't think we have done that yet.
Okay. Okay, let's see. And then we have a question from Anne, who I think, let's see, she said, as far as the recommendations, and maybe we could look at the Parkinson's Foundation recommendations, but she asked, how long would you suggest the HIIT sessions would be? Or that you did in your study?
The one we did in our study, we use in our study, the Beat Parkinson's Today program. So that it's about 55 minutes or so. So they have a warm-up period, about 30 minutes of high-intensity interval training with some boxing as well. And then they have the cool down with visualization meditation in the end for relaxation. So it's about 55 minutes or so. But the high intensity chunk of it is about 30 minutes.
Yeah, okay. Yes, that's good information. And the questions are coming. So,
Right.
Okay, we have a question from Cynthia, and she wants to know, she said, after a certain amount of exercising, her husband is exhausted. That's like completely down. Is that normal?
Yeah, that happens. I hear that. I don't know the particular situation here, but one thing that's important is to hydrate really well, rigorously before and after, because some people have what we call orthostatic hypotension, right? With some, even just standing up from a seated position or some mild exertion can lower the blood pressure, or the blood pressure can't be maintained. In that situation, you will feel, if that is the case, you'll feel extremely exhausted after exercise. So that's one thing. Is that the case? blood pressure? Is there orthostatic hypotension? That needs to be discussed with the neurologist. Rigorous hydration before and after exercise would be one of the most important remedies if that is the case. And regardless of orthostatic hypotension, hydration is very, very important. If the person is taking the medication, carbidopa, levodopa, or any dopaminergic medication, I would recommend taking the medication maybe about an hour or so before exercise, or scheduling the exercise classes accordingly. So being properly medicated makes a difference. It will give the required boost. And then after exercise, taking a nap is perfectly fine.
Yeah. I think, and what is your feeling? I've heard, Jimmy Choi, for example. I don't know if you're familiar with him, but he's a ninja warrior, American ninja warrior, and I know he sometimes takes extra dope, of his cinnamon before he's going to do a very high intense workout. Is that something that you think is?
It's okay to do that. Yes, I think it's okay to do that. This is a discussion I have with my own patients. Sometimes they're too afraid of increasing the medication dose, and I tell them, look, take that extra half tablet before exercise so that you can put in more effort and take more benefit from exercise. So just small adjustments, I think is okay, but obviously they need to discuss with their neurologists.
Yeah. Well, I think if they can maximize, or for the people listening, maximizing your mobility so you can get as much exercise in as possible is to their benefit.
That's right.
Yeah. Okay. So what do you think for people? We have one question again from Robert, who was asking, the people in your study, I assume you said they were diagnosed within 4 years, but a lot of times people might have Parkinson's longer. I mean, for much longer before they're diagnosed.
That's right.
So I guess he's trying to figure out if it's from the beginning of their disease or not, but I would assume that's a little bit.
Oh, symptom onset. That's right. That's a good question. As most of you know, once we see the motor symptoms of Parkinson's disease, that's just the tip of the iceberg, right? The process probably started a decade or maybe even 2 decades before. So it's a bit arbitrary to call it early disease. We made that determination based on the subjective symptom onset. Like the person said, oh, I had this tremor 2 years ago, and then I went to see my neurologist, diagnosed me with Parkinson's, etc. So yeah, symptom onset. But absolutely, it probably started much earlier than that, which brings to mind another important point here. We talk about exercise as medicine, but we should also think of exercise as a preventive intervention, right? Because nowadays we have the capability of diagnosing people in the so-called prodromal phase, the dream reenactment, loss of sense of smell, constipation. Some of the early signs or symptoms of Parkinson's disease can be detected, and there are ways to identify them and give a score to each symptom and diagnose someone with prodromal Parkinson's disease, meaning very early stages. It hasn't completely manifested yet as Parkinson's, but eventually it will in a few years, most likely. That's what the prodromal stage is. So if we can catch people in that stage, and there's a lot of research going on for that, and advise them to do high intensity or regular exercise, it might actually have a preventive effect. So that's another interesting research question, and there are some efforts along those lines. Just following those people and seeing if maybe they want to develop Parkinson's disease, or maybe that would be delayed. The onset of Parkinson's will be delayed. So that would be the preventive use of exercise.
Yeah. Well, I guess having the people being able to catch the prodromal stage is the trickiest part. And with here we're in Austin, Texas, and there are not that many movement disorder specialists here, and there's long wait times to get in. So and I know it's like that in many parts of the country and the world.
That's right.
So it's tricky.
It is tricky. It is tricky. Yeah. We just recently started focusing on that here at Yale. So some academic institutions will have the resources and the know-how can do it, but I understand it's not easy. But some of the important harbingers, one of the most important ones is the REM behavior disorder, dream enactment, yelling, kicking, screaming, thrashing in the dream phase of sleep. So that's an important sign that person would be at risk of developing Parkinson's disease. Yeah.
Well, that's good advice. Good to know, I think, for people. We've made a big effort to attend different health fairs and speak to different groups just about Parkinson's, so the general public will start to understand more about Parkinson's, and I hope our audience too shares what it means to have Parkinson's. Not everybody knows, especially the symptoms can be so all-encompassing, but most people just think of it maybe as a tremor. So they don't know really what it is. And I find even some, and I was a primary care doctor, but even primary care doctors don't know the whole extent of Parkinson's.
Absolutely. And the so-called non-motor symptoms, right? Sleep problems, mood issues, fatigue, in later case stages, dementia, psychosis, all of those things in many cases are much harder to deal with for people and the care partners. So I guess, a little bit of tremor is a nuisance, but you can live with that. But, depression, fatigue, they take a huge toll on people.
Yeah. So, do we have any more questions? I think we might have one more, but I have I was going to ask if you have any plans for a follow-up study.
I do.
That you would want to share.
Absolutely. No, absolutely. I'm working on this. As I mentioned, this was a proof of concept study, a small pilot study. So my goal is to turn this into a randomized control trial to enroll a control group and do a larger study. Again, use brain imaging modalities, PET scans, MRIs, and looking at the neuroprotective effects of exercise as well as its effect on cognitive functioning, right? So memory, executive function, etc. So that's the grant that I will be hopefully resubmitting at some point. NIH funding is not easy to receive, especially these days. Lots of issues, unfortunately. So it depends on funding. If I can have the funding, I have the researchers and the resources. So it all depends on funding. But I definitely want to do that. And another grant, another research study that I'm working on is what can we do. And I have my collaborators. What can we do to disseminate and implement exercise more efficiently for all people with Parkinson's at the institutional level, at the individual level, coming together with healthcare providers and trainers, etc. So that's also going to be a research project. So just to make it widely accessible for everyone, what are the barriers, what are the enablers, and what can we do about that? So those two projects, hopefully, if I have the funding, I'd be very excited to start the work.
Okay. Those are very important questions, so I hope you get it.
Thank you. Fingers crossed.
It would be nice to have that data, I think, even though I know what we've observed and anecdotally and just all the response from our patients.
But
it
if
would
we
be
can,
nice.
that's right. If we can definitively or almost definitively show the neuroprotective effects, so that brings more legitimacy to exercise as medicine, right? There is
Yes.
not a single medication, single pharmaceutical agent that has shown that effect yet. So if exercise does that, that would be pretty impressive. So
Yes, absolutely. Well, Heidi's asking a question. I have a thought about it, but I'm going to see what you have to say. Um, she asked that if you start exercise later in the diagnosis, will it help turn back the clock on Parkinson's?
I think there's never too late to exercise. Absolutely. Whenever you start, just I'd say go for it for everyone. Um, it's hard to disentangle whether it's symptom improvement or whether it will make any difference in the disease course. So that's a research question at an individual level. It's hard to say, but it's never too late to start exercising. There would at least be symptom improvement. Well, you might actually be able to again slow down the disease progression. So yeah, never late. And as much as they can, I would recommend exercising. Even if a person cannot do high intensity exercise, that doesn't mean they're not going to get any benefit at whatever intensity they can exercise. And if they can do that frequently enough, that is already great benefit. And there are now new studies that show that, and it's called the exercise volume, right? Maybe it's not just the intensity, maybe it's also the volume, meaning how frequently you do a certain amount of exercise. So in other words, if you do only 1 or 2 high intensity exercise classes per week, and for the rest of the week you have a sedentary lifestyle, that's not very helpful. On the other hand, if you do maybe moderate intensity exercise, but you do it every single day, that's probably much more beneficial. So the volume of exercise is higher. So there is research that shows that. So not being able to do high intensity is absolutely not the end of the world. Whatever you can do, just do it regularly and as frequently as you can would be my advice based on what we know so far.
Yeah, thank you. Yeah, that's great. I know we have people of all ages that attend our classes, and we have one gentleman who's 87 years old and moved to Austin a couple years ago and started taking our classes and had dramatic improvement, decreased his freezing, and he was able to start using his mouse on the computer again. And he is keeping up with the whole group. He's doing fantastic.
Yeah, that doesn't surprise me at all. I see it all the time.
Yeah. And on the other hand, there's another, I like this anecdote because I founded Power for Parkinson's in my dad's honor and now memory, but he didn't really exercise, but when he was very, very, very advanced, and could barely even walk and couldn't really feed himself, if I got him to do even 5 to 10 minutes of exercise, seated exercise, he could then go and the tremors would calm. He could feed himself. He could walk with his walker to the kitchen. I mean, it made just that 10 minutes made such a big difference.
That's
so,
right.
So I would encourage everyone out there to start when you find something.
That's right. Absolutely. Just adding some disability-free months or years to your life is a huge advantage, I think. Yeah.
Yeah. Yeah.
Yeah.
Well, I think we finished with our questions, and you have provided us with such great information. Do you have any parting words for the Parkinson's community?
Just exercise.
Yeah.
That really is the main message. The medications that we prescribe are good for symptom control. They help you move better, function better. That's for sure. But being able to change the disease course and have more symptomatic benefit and hopefully protect your brain, exercise really goes beyond medication because it targets so many different mechanisms in the brain and in the body all at once. There's not a single medication that has the capacity to do that. So really, really important. The more the merrier, whatever we can do. Never too late and never too early either. I sometimes hear that, oh, my symptoms are too mild and barely noticeable. Maybe it's okay, I don't have to. No, on the contrary, that's the time to start exercising rigorously. So yeah, just go out and exercise, please.
Great advice. Thank you so much for your advocacy. I think it's so important. I know everyone really appreciates your efforts, and I know our whole team does. We're very grateful for your work. It's been an inspiration for our instructors and our team. So thank you very much.
And I appreciate your work, all the exercise programs, trainers, yours and others. I think you're doing a very, very important work and making a huge impact on the lives of people with Parkinson's. So I appreciate your efforts a lot. Thank you.
Okay. Well, thank you so much.
Thank you for having me.
And we'll put a link to your study within the YouTube notes so people can access that. And thanks again.
Thank you very much. Have a good day. Take care.
You too.
Thanks.
Bye-bye.